Hey, I'm Dr. Daniel Carter. I've helped seniors navigate Medicare for years, and there's one big Medicare mistake that can quietly cost you thousands of dollars in 2026, and most people don't even realize it. Let's fix that. The problem: only about 61.5% of seniors actually enroll in Medicare right at age 65, down from 81.6% in 2000. Almost 4 in 10 are missing their initial sign-up window, and that can be a huge problem. If you're in that 40%, you're at risk for coverage gaps, lifelong penalties, and surprise bills. Research shows roughly 750,000 people are already paying late Part B penalties, adding over $8,000 to their lifetime Medicare costs. In short, miss your enrollment deadline or misunderstand the rules, and you could drain your savings without realizing it. Reason 1. Confusing coverage rules. Many folks mistakenly assume COBRA or retiree health plans mean they can delay Medicare, but Medicare.gov and AARP make clear that COBRA, or retiree insurance, does not count as qualifying coverage. In fact, if your employer has under 20 employees, Medicare is primary as soon as you hit 65. The result? You might forgo Medicare and then get slammed. Medicare.gov warns that each full year you delay Part B adds a 10% premium penalty for life. People fall into this trap because Social Security age is now 67, so there's no auto-enroll at 65. You must sign up yourself. Reason 2. Hidden penalties and surcharges. Even beyond signing up late, some costly traps hide in the details. If you skip Part D coverage, there's a 1% per month penalty for each month you were uncovered. That penalty never goes away. And high incomes trigger IRMAE surcharges. For example, in 2026, a single filer with 2024 income over $109,000 pays a $284.10 per month Part B premium instead of approximately $203, almost $81 extra every month. That's nearly $1,000 a year, adding up to $10,000 plus over time. Many seniors don't see those surcharges coming. If your income drops later, say you retire or lose a spouse, you can file for an IRMAA appeal. SSA notes life-changing events let you request a reduction, but most people never do. Reason 3. Missing out on financial help. Another big cost driver is not getting aid you're entitled to. Programs like Medicare savings programs for Part A/B costs and extra help for drug costs can slash expenses, but many don't apply. In fact, analysis shows enrollment in these assistance programs is well under 60%. That means a lot of low and middle-income seniors pay full price. According to Medicare Rights, qualifying for an MSP and the Part D low-income subsidy typically saves about $8,400 per year. If you assume you make too much or just haven't heard of them, you might miss thousands in savings. Solution 1. Sign up on time and double-check your situation. Mark your Medicare initial enrollment period, 3 months before to 3 after turning 65, on your calendar. If you're still working past 65, plan to enroll during the special enrollment period. You get an 8-month window after you stop working or lose your employer coverage. Call 1-800-MEDICARE or Social Security to confirm your dates. If you have employer coverage, ask HR whether Medicare is primary. AARP suggests small employers often put Medicare first. Bottom line, don't assume any health plan covers you. Sign up for Part A/B when you're eligible and for Part D ASAP even if you don't need drugs yet. That avoids any lapse in coverage or automatic penalty. Solution 2. Manage penalties and appeals. Keep proof of any prior coverage. If you had employer or retiree drug coverage, get a creditable coverage letter from the insurer. It shows Medicare you were covered, so you owe no Part D penalty. Watch your income. If you think you might owe IRMAA and your finances change, file SSA Form 44 with Social Security right away. SSA explicitly says that events like retirement, divorce, or a spouse's death let you request a lower IRMAA. It's free to do, so don't pay extra just because you didn't know this. Also review premiums every year during annual enrollment to make sure surcharges haven't crept up unnoticed. Solution 3. Tap cost sharing aid. If your income is modest, apply for Medicare savings programs and extra help. Medicare.gov says to apply through your state office, and apply even if you think you won't qualify. Those programs can cover your Part B premium, deductibles, coinsurance, and drug copays. The SSA website also lets you apply for extra help for Part D, and you can do it anytime. It will cap your drug costs, often to just $4 to $7 a month per med. In practice, that means big annual savings. If paperwork or rules are confusing, contact your local state health insurance assistance program, SHIP counselor, or Medicaid office for free guidance. Bottom line, don't treat Medicare sign-up as optional. Plan ahead, meet the deadlines, and use the help that's available. Avoiding this one common mistake could save you thousands of dollars in 2026 and beyond. If this was useful, hit subscribe for more expert tips and stay ahead of your Medicare.